All right. Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, What is Sepsis? The Common Illness You've Never Heard of, is presented by Tanya Cutone, Nursing Director, Emergency Services, Pediatrics, Informatics at Chilton Medical Center. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of the presentation. At Atlantic Health System, we encourage everyone to be an active partner in their healthcare. We recommend using an online tool called MyChart to help you manage your care. MyChart is an interactive tool that gives you 24/7 access to your electronic medical record. Anyone who is a patient with Atlantic Health System can open a MyChart account. This includes anyone who's visited an Atlantic Health System provider for routine visits, vaccine visits, or even an Atlantic Health System emergency room visit. If you are not a patient of Atlantic Health System, you may have access to MyChart or similar platforms through your usual provider. MyChart allows you to manage many aspects of your healthcare. Some of the most popular features allow you to request your medical records, access your medical information, test results, medications, allergies, diagnosis, send non urgent messages to your provider's office to request medication refills or ask questions, view your clinical notes and after visit summaries, schedule appointments online, e check in for appointments, which makes the check in and rooming go much faster. View and pay your hospital bills online, share your MyChart with family, friends, and vice versa. For example, you can get access to your child's MyChart so you can manage the whole family from one account, or senior parents can give access to your adult children. If you want to set up a MyChart account, need help logging into a current account, or have questions about how to use MyChart, there is help available 12 hours a day, 7 days a week. We recognize the fear, uncertainty, and confusion that surrounds making decisions related to musculoskeletal pain. In a sea of information overload, it's hard to know what's what and where to go for the orthopedic care you need. Atlantic Health System has your back the entire way. We've got, when you've got questions, we've got your answers. And without further ado, I am now going to turn things over to Tanya. Oh, and Tanya, you are muted.
Okay. Can everybody hear me now?
Yes.
Thank you. Sorry, everybody. Good afternoon, everybody. Thank you, Ashley, for the preview and the introductions. As Ashley stated, my name is Tanya Catone. I am the director of the Chilton Medical Center Emergency Department in Pediatrics. I've been a nurse for 34 years here at Chilton, and have seen many patients with sepsis, as well as how the science has developed. So we'll begin with what is sepsis? Sorry. So did you know that sepsis is one of the leading causes of death in the United States hospitals? It affects about 49 million people worldwide each year. And about 37% of the adults have never heard of sepsis. So today's session will give you some insight about sepsis, how it can develop, who's impacted, and what you can do about that. Around 72% of American adults can identify a stroke or a heart attack, but they cannot identify a sepsis symptoms or developing sepsis. About 12% of adults only know the common symptoms of sepsis. So people who have had sepsis or developed sepsis, if some of you on this call may remember Patty Duke, she died because of sepsis. And people didn't realize that originally that was her cause of death. Jamie Lynn Siegler, she's known for the Sopranos series. She almost died a year ago from sepsis. Former NFL player Mike Williams, he also died of sepsis that started out as a dental issue. So that went through his body, the symptoms, and he became septic. And then Emily in Paris actress Ashley Park, she is also recovering from septic shock after a severe case of tonsillitis. So as you can see there, it could affect anybody at any time and age. So what is sepsis? It is a body's response to an overwhelming life-threatening response to an infection. It damages your main vital organs and can lead to death. About 1.7 million people it affects in the United States or worldwide, and about 350 lives in the US are lost every year. It's a lot of people. Sepsis is one of the leading causes of death in the US hospitals. And approximately 6% of hospitalizations are due to sepsis, and 35% of all deaths in a hospital are due to sepsis. It takes more lives than drugs, opioids, or breast cancer and prostate cancer all combined. It can cause any type of infection, or it can be caused by any type of infection, a viral, bacteria. In nearly half of the cases, no pathogen has been identified. And we'll talk a little bit more about that as we get further along. It's one of the leading causes of readmission in a hospital. Nearly 40% of the patients with sepsis are rehospitalized within 90 days. That's 3 months, you're back in. And nearly 87% of the sepsis cases originate in the community and not in a hospital. What can cause it? It is caused by an infection that you or your loved ones can get when germs are spread into your body. It can be caused by an infection. It could be simple as a cut. If you don't stop that infection, it can cause sepsis. Bacterial infections cause most of the cases of sepsis, and it can result in other infections, including viral, such as COVID, influenza, or a fungal infection. Same when you go to a beach and you're in the water and you get cut by a seashell, that can develop into sepsis because, people think salt water, it's okay, it'll go away, but it's a body's response on how whatever got into your bloodstream, the bacteria, the virus, reacts to that infection. Sepsis is not contagious. It is not like HIV. It is not like any other type of hepatitis. You cannot spread sepsis to other people. However, an infection can lead to sepsis, and you can spread the infection to other people. Different thing. Remember that sepsis is a body's reaction to an infection. Some common infections that we see or can lead to sepsis are urinary tract infections, strep throat, influenza, MRSA, which some of you may have heard about MRSA also. Who can get it? There are higher risk groups than others, but adults 65 or older. You have children that are younger than 1 year of age are high risk to become septic, pregnant or postpartum women. People with chronic conditions like diabetes, lung disease, cancer, COPD, kidney disease. People who have recently had severe illnesses, surgeries, or a hospitalization. Anybody with a weakened immune system. And then people who have survived sepsis are at a higher risk. But it can affect anybody. These are just the groups that you have a higher incidence of developing sepsis. So what's important to know about sepsis? Just like in other disease processes like stroke, we have BFAS. We have for sepsis time. Time is your friend, time is important. That's when we have to look at each of these letters and we've defined them out. T for temperature, I for infection, M for mental decline, and E for extremely ill. This is when you need to call a provider or come to the hospital. So for time, time is very important. For every second that you pass, you can develop septic shock. Septic shock can develop within 12 to 24 hours from onset of your body's reaction. And sepsis is the severe response by your body to that infection. So all your white cells, all those things that fight infection, it is a storm that is happening and it's trying to fight. But your body's not doing a great job doing that. So time, the longer your body fights, the weaker you get and more symptoms develop. So time is very important. I is for the infection itself. The infection could start anywhere. For example, your urinary tract infection, or I said, a seashell nicked you on the beach. All those are the infection coming in and getting in through your bloodstream. Again, it is not contagious. You can't spread it. M is for mental signs. So there, as the infection progresses, you can become more disoriented. You're feeling very sleepy or you're unable to be awakened. Now, this is not somebody who loves to sleep like I do, hate getting up in the morning. So those are common to me. Disoriented, if somebody already has disorientation, dementia, this would not apply for them. These are new signs. They're a bit confused, very sleepy, like they just want to go back to bed from from waking out of bed, or they're unable to be aroused in bed. Those are all new symptoms, and those are concerning in combination of the other symptoms. Extremely ill. You will have people say that they feel like they're going to die. They've never felt like this before. And that is a common statement people who are septic will say. They have fever, shivering, they feel very cold. The shivering is very, very hard and you can't warm them up. Rapid breathing, they become short of breath. And as they speak, you'll hear that their breathing is rapid. Extreme pain. Sometimes people have a lot of joint pains. They become pale or mottled. You could see their skin, their lips. Again, if it's somebody who has respiratory issues, somebody like COPD, that would be a common thing for them. This is somebody who typically do not have these signs. They're disoriented, as I stated before. They confused, sleepy, difficult to awaken, and an elevated heart rate. In combination, these symptoms, at least two or more, that is time for concern. I'm not sure if this is too small to be seen, but this is a grid of where and timing of when to call or come to a hospital. The green zone, to be in this zone, you must be feeling very healthy. You keep monitoring for any signs of infection. So you got a cut. Now you leave here after this webinar today and you get a cut. Now you start to think, oh my God, I'm going to become septic. Well, no, you just have to monitor yourself or your loved ones. So you get a cut. It looks okay. There's really no pus coming out of it. There's no redness up around your arm. You're okay. Just keep watching it. The yellow zone, this is where you could start seeing some signs of an infection. As we all know, we've gotten cuts and they become red, a little bit tender. We're still good, but we're watching it. We're just watching to make sure that I get no increase in pain or shortness of breath, any fevers, or I'm feeling chilled. That's where I'm in my yellow zone. I would call my doctor if I start seeing something like that. And then the red zone. This is where you're confused, groggy, the infection really doesn't look great, and your heart rate is now faster, you're short of breath, and those big statements, I feel like I'm gonna die. I went to bed because I didn't feel good. I woke up and I feel worse. That's when you call 911 and you come to the hospital. And we'll have some questions and answers at the end regarding these. So what do I do if I think a loved one might be septic? Again, it's a medical emergency. You are to call 911 or you come to the hospital right away. And again, for every hour that the treatment delays, there's a risk of death increases between 4 to 9%. So again, time is your friend. And or if you want to call your doctor and screen yourself before coming to a hospital, that is also acceptable. But if you cannot reach the doctor, please do not wait. Again, a review of the signs and symptoms in adults, which could be sepsis, sleepy, slurred speech, confused, extreme shivering, cold, fever. Your skin is pale or clammy to the skin. You're short of breath. You feel like I might die. Again, that statement. And your skin is either mottled or discolored. Children can also become septic. Any child who feels abnormally cold to touch, or they look mottled or bluish, or has very pale skin, that is not common for a child. They have a rash that hasn't faded when you, or doesn't fade when you press on it and try to blanch it, it doesn't. That's also one of the signs connected with everything else. There's more than one of those. Their breathing is fast. So if I have the rash, I have a breathing is fast and my skin is cold to touch, and that's not my normal child, that is a concern. They have convulsions or seizures, or they become very lethargic and difficult to wake up. That is not a common sign for a child. There's something wrong there. Children under 5, since they cannot always verbalize, they're not eating, they're vomiting, hasn't urinated for 12 hours or more. There I would call their pediatrician, and if they really are not arousable, then you would call 911 for an ambulance to come and take them. So we review this, especially with older adults because of grandchildren. A lot of times you're the one that spends more time with them as they get, they're with you. So these are symptoms that you should know for children. Pregnant women can also become septic, and they have a weakened immune system because they're carrying a second human in them. So if they have a fever of 100.4 or more, if they have any type of discharge or wound, foul smelling, they're also difficult breathing and shortness of breath. Again, in combination, chest pain, feeling confused or just not right. And then just non-specific or general abdominal pains, like if it's not, if you don't think it's part of the pregnancy, I would call the doctor and let them know that what you're feeling, and then they can direct you. If you feel really sick, ill, the words that we keep using, you felt never like this before, you feel like you're gonna die, that's a 911 call. There are complications of sepsis. Some of them, if left untreated or there's a delay, it could lead to some severe complications. Because sepsis is a response to an infection, your body normally or at any type of trauma tries to preserve your major organs. If you lose a limb, if you become stuck in the snow and start getting hypothermic, your body automatically tries to bring all the blood into or towards your brain, your heart, your kidneys. That is just a reaction normal that a body does, a human body does. So what happens is that your other areas, your extremities, your nose, your ears, blood flow gets cut off to those. It reduces the blood flow where clots could form. Um, these clots lead to gangrene and then requiring amputations of affected limbs, toes, or fingers. So you will see a lot of stories once you start researching sepsis that a lot of people end up with amputations because the blood flow was sent to their major organs to make them survive. You can survive without fingers or an arm or a leg, but you cannot survive without your brain, your heart, or your kidney. It is called a disseminated intravascular coagulopathy. Your blood starts to clot because the blood flow is reduced. And we'll look at something towards the end. We're going to have a video about this so you can see what it looks like. How can I prevent sepsis? Well, there are certain things that you can do. Wash your hands, wash any type of wounds that you get a cut. Many a times I personally get a paper cut and I do nothing about it. I continue working. So that puts me at risk, especially as I get older. I should be washing that paper cut. Treat infections, follow instructions for prescribed medications, complete those medications. Don't take a couple of pills and then forget about it because now your body is not responding appropriately with those antibiotics. You are conditioning your body if you take only half doses. Vaccinations are very important. In the beginning, I talked about who's at risk. As long, have your flu shots, your COVID shot, your immunizations. Those are the people who are high risk to become septic. And immediately take action when an infection is suspected. Go to the doctor if you feel you have an infection and do one of those web calls and let your doctor see it through video. You can do that also, and then the doctor can recommend what is needed. So how can I get ahead of sepsis? Well, the first one is preventing infections, taking good care of chronic conditions, COPD or asthmatics, diabetics. Keep those disease processes at bay so it doesn't weaken your immune system. Get your recommended vaccines as preventative. Practice good hygiene, not only washing hands, but all over body, anything you get. Make sure that they're covered, a Band-Aid, a gauze, and change them so no infections are produced under there. And know the signs and symptoms. After today, this will be posted. Ashley will discuss of where that is. And then there's tons of information out on the web. And then act fast. Time is really your best friend when it comes to sepsis. Again, we're going to show you a quick video. Ashley?
Yes. Perfect. Great. We appreciate you joining us today. We kindly ask if you can take a few minutes after today's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. A special thank you to Tanya for dedicating your time and expertise today. If you have additional comments or questions, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499. Option 3. That concludes today's webinar, and thank you, everyone. Have a great day.